Good morning, friends. Dr. Anirban Mujumdar here. I am the professor of endocrinology in the KPC Medical College, Kolkata. Today I am going to talk about the objective of diabetes management. Why we want to treat diabetes. Say, for example, one young guy of 35 years has checked his blood sugar. Fasting came 185, PP came 235. He's fine. नो प्रॉब्लम, जिंदगी अच्छा चल रहा है. क्या करना है? कुछ करना है? नहीं करना है. Should I do something? Should we take some action? That is the question. If you do not have any problem, even if you have diabetes, then we have to control the diabetes. Why? कुछ तो नहीं हो रहा है. क्यों करना है? Because of the fact that if you keep it as it is, then the blood glucose level may go up and can reach to a very, very critical level, maybe 500, 600, at which point of time you may develop some complication. The complication may require hospitalization. So we call it an acute complication. So if the blood glucose level goes very high, then you can develop some serious acute complications. So that is why we have to treat. The second most important cause that if you keep the blood glucose in the level of 200 or 300, sometimes you may not develop acute complication, but in the long run, if you don't control it for a long period of time, then you may develop some complications. And many people are aware about the long-term complications of diabetes. So you may develop some problem in the eye, you may develop some problem in the heart, you may develop some problem in the feet, you may develop some problem in the kidneys. So lot of organs may be affected, lot of organs may be damaged, and because of this damage, you may have to spend more, number one. Number two, you have to face lot of physical problem, and third, you may require hospitalization, and lastly, sometimes you may die because of the complication. Because we know that the heart complication is a very, very serious issue, and majority of our diabetic subjects die because of cardiovascular cause. So friends, be careful about your diabetes from the very beginning. When you have first detected your diabetes, then you should take control over the diabetes. Then when we should check? This is a very, very pertinent question. So I would like to advise that all of you should check your blood glucose at least once in a year. So even if you do not have diabetes, you should check it at least once in a year. If you have diabetes, then you have to check it more frequently as advised by your treating clinician. So therefore friends, check your blood sugar every year if you are aged more than 20, and even if you are aged less than 20, and if you are obese or if you have a family history of diabetes, you should check your blood sugar once in a year. And therefore once you got that your blood sugar is high, then immediately you should start taking some action. Now the action actually is multifaceted. एक चीज करने से नहीं होगा. You have to do multiple things. Say for example, someone wants to pass class 10. Then what are the actions he has to take? Number one, he has to enroll himself in the school. Number two, he has to read books in the house. Number three, he has to attend the class regularly. Number four, he has to appear in the examination. And number five, he has to go to school to collect the report card. So something like that. So if you have diabetes, you have to do multiple things. There is no shortcut way by which we can control diabetes. There is no shortcut way by which we can prevent diabetic complication. I understand that taking care of yourself is often very, very tiring, and sometimes it will pinches in your pocket also. But spending for diabetes will have long-term benefit because it will prevent the person from developing acute complications which are serious, which may be more financially draining, and which is more physically tiring. So therefore, friends, do take care of your diabetes from the very beginning. And if you do not have diabetes, check your blood sugar every year. And how we can control? I'll just tell you that the 5 important methods by which you can achieve a good control. So first important issue is take care of your diet. So we will have another session on the diet where we will talk about how to have a good diet. So first step is to have a good diet. The basic principle of the diet is that you have to keep a normal body weight. So check your body weight. If your body weight is more, you have to curtail your diet. You have to reduce your diet. थोड़ा कम खाना है. So if you can reduce your diet, if you reduce your calorie intake, you will be able to reduce your body weight. But remember, it is a lifelong effort. ये ऐसा नहीं है कि 6 महीना कम खा के फिर हम ज़्यादा खाना शुरू कर दिया. No, you have to control your diet for the rest of the life. It is a lifestyle change. You have to change your lifestyle so that it will have a sustained benefit throughout your life. This is number 1. The second is you have to do some kind of exercise. And we always advise our patient to do at least half an hour exercise. If you do less than half an hour, it will not have any health benefit. So do at least half an hour exercise daily. If it is possible, do it daily, 7 days in a week, 30 days in a month, 365 days in a year. But if you cannot, you may miss sometimes, then you should not miss more than 1 or 2 per week. So at least you have to do 5 days in a week. So friends, do regular exercise. This is the second most important issue apart from diet. The third important issue is you have to avoid smoking completely. So no smoking, no tobacco, no jorda, no guraku, no any kind of tobacco. So these are the 3 important basic parameters as far as the lifestyle management or lifestyle change is concerned. The next come is the drug which we conventionally use. Many drugs nowadays, we have lot of drugs available in our armamentarium, and we judiciously use the drug to keep your blood sugar under control. Then you have to look into the education. More and more you know about the diabetes, you will have better control on your diabetes. We always want that you should know more about diabetes. So education is very important. So you should educate yourself by looking into videos, by looking into different websites through which you will get a lot of informations about the diabetes. Next will come is your monitoring. We have seen the monitoring is very poor among our diabetic subjects. So monitoring can be done very easily. So you should buy a glucometer. Glucometer is easily available over the counter. You can buy a glucometer, check your blood sugar regularly. How much frequently? It depends on which drug you are on. So maybe you should do it at least once in a month. If required, you have to do it once weekly. And if you are in a serious condition, maybe you have to do it 5 times, 6 times, or 7 times in a day. That depends on the situation. But do buy a glucometer. It is very, very useful. You can check it anytime, whenever you want. If you feel uneasiness, you can check your blood sugar and see that whether the blood sugar is high or low, and you can take an appropriate action. If you are going out for a travel, and then also you can check your blood sugar whenever it is necessary. So friends, we have 5 major steps to achieve a good glycemic control and good control on your diabetes. Number 1, diet. Number 2 is exercise and other lifestyle measures. Number 3 is the drugs which your doctors will prescribe. Number 4 is a good education, knowing about diabetes. And number 5, monitor your diabetes, if possible by glucometer. If you want, you can monitor it with the lab also. So thank you guys for your kind listening. So do implement all these issues in your life. Thank you very much.